Hi, my name is Parisien. I'm a denturist and the owner of the Parisien Denture Clinic in Windsor, Ontario, and today I wanted to talk to you about implants. In my first video, at the very end of it, I had briefly touched on how dental implants can help you out with a full lower denture. This is because of the fact that a full lower denture will never get suction. So what the implants do is they help retain or hold the denture in your mouth. Now, I know a lot of you are just scared to death of the thought of having an implant put in, whether it's just from the fear of having surgery done to your jaw, or whether you've seen pictures and you've seen what the implant looks like. Because I'll be honest, for lack of a better term, an implant looks a lot like a screw. And it's something that seems scary to most people, but I can assure you, from all the people I have ever worked with implants, that across the board, everybody has told me that having a tooth pulled hurts more than having an implant placed. Having an implant placed is not an invasive procedure at all. It's very precise. And the worst part of it afterwards is just letting the gums heal, which again, like I say, most people say having a tooth pulled hurts more. So you'd have your implants placed. And let's say if we're talking about 2 implants in a lower denture. The implants generally on average take about 3 months to heal until the point where we can work on them. After that, your new teeth would be made, and then we're ready to start to attach the teeth to the implants. So here's a little model demonstrating that. Here we have a full lower denture. Now, in this model, you can see the implants. Now, I know it might look a little strange, and it kind of gives it a bit of a fishbowl effect. The implants look bigger than what they actually are. But what happens is that you have, it works a lot like a button on a jacket. Inside the lower denture, you would have one part of the button, and inside your mouth, you would have another part of the button. These little nubs, what we call an abutment, stick just up above the tissue, and when you put your denture in the mouth, you put it down and then you press, and you're going to hear it click. And the denture is now secured onto the implants, and you go from having a lower denture that lifts up and down all the time or can move around to having a denture that doesn't go anywhere, and you have to get in there with your thumbs or grab it however you prefer, and you have to actually pull it up off the implants. It's an absolute night and day difference to compare to a lower denture on its own. 2 implants for a complete lower denture is actually what we call the minimum standard of care. You can Google it, Google McGill University, and they held a symposium with some of the top names in prosthetics and prosthodontics, and they all agreed that basically if you're wearing a full lower denture, you should have implants, because we all know that a full lower denture inherently doesn't fit good because it doesn't get suction. It always wants to lift up and down. Now, from here, you might say, you know what, yeah, that's what I want. I don't mind wearing a denture, and I just want it to not move as much anymore. This would be the answer for you. From there, you can go ahead and you can have permanent teeth with implants, meaning that these teeth will never come out of your mouth. They're basically like natural teeth. If you were to look online and search for a procedure called the All-on-4, you're going to find something that looks like this. So what we do is we put in 4 implants. Sometimes you need a 5th. It all depends on the quality of the bone. And then your teeth are secured to those implants. And like I said, these are permanent teeth. You can't take these out. These are attached right to the implants. And the nice thing you'll notice is, especially with an upper denture, this is an upper model, the upper has the roof of your mouth completely open. It's not covered anymore. We don't need it to be covered to get suction because the implants are holding everything in place. So the first thing that this will do is you can taste your food again. And anybody who wears a full denture on top knows that the second you put it in and try eating, food just doesn't taste the same anymore. The taste is almost gone. Everything tastes a lot more bland. So this kind of eliminates that issue on top of the fact that your teeth just don't move anymore. Now, like I said, you can Google the all-in-4 procedure. You're typically going to find a lot of surgical videos on it, so if you're squeamish at all, don't watch it. But this procedure where you end up with the teeth, this is normally done all in one appointment. It would typically take, I'd say on average, about 5 hours from start to finish, to the point where you walk out of the office with teeth in your mouth. And you can go home and you can start eating right away. You're not eating an apple or anything like that, anything hard, but you can go home and you can eat right away. There's no waiting for healing to happen. So that is briefly what can be done with implants, and there's many more options with implants, but with full dentures, those are a couple of the more popular ones. Like I said, the biggest fear that most people have is just the fear of having the implants placed themselves. But don't let that be the factor that stops you from getting them, because they can make such a big difference in how you feel with your teeth in your mouth, and just how you feel about yourself after you have the confidence of knowing that your teeth aren't going to move anymore, or that they are going to move much less compared to what they would with just a regular full denture. So I hope that's helpful for you in kind of understanding what implants are. And if you have any questions or comments, please write them down below. And if you have any suggestions for videos that you'd like to see, please write them down for me. Take care.